Hey guys, my name's Chelsea. We're here at the West Virginia Junior College and we wanted to have you guys join us on our Facebook Live here in our lab. We are going to have some of our students demonstrating the procedures that we perform here on our lab days. So we're going to go through a few things like vital signs, injections, drawing blood, urinalysis, and a few more things that we want to show you guys. So come this way with me. The first thing that we're going to do is our EKG. And we're going to use our handy dandy little person. We have never given her a name yet. Anybody want to give her a name? Lola? Lola. Okay. So Lola here, she doesn't have any arms or legs. And we typically do practice this on each patient, and we will put the electrodes on the real place on their arms and their legs. We can't do that on her, but we also take into consideration if your patient doesn't have any arms and legs, where would you put those in the different placements? So what are we going to do first? We are going to, of course, assess our patient, and make sure their skin is not oily or wet or anything. We want those electrodes to stick really well. Typically, if you have that problem, you can use an alcohol swab or tape over the electrodes. So we're going to let Aaliyah put the electrodes on our patient here. And again, this patient has no heartbeat, so, we're not going to really get any rhythm, but we would whenever we practice on ourselves in here. So she should have counted down from the first collarbone here down to the fourth intercostal space to the right of the sternum, which is our first electrode, and then to the left of the sternum is the next. So we typically teach to go onto the fourth, which is at the mid-clavicular line in the fifth intercostal space. So we're going to put that one right around here underneath of right in the middle line. She put the third one here. I probably would have put it maybe a little bit more in the middle up here, just because we want it in the middle of the second and the fourth intercostal space, but you can leave it there for this purpose right now. We'll move it if we need to. And this body is a lot different. You can't really feel the ribs in there, so it's hard to be able to get an exact placement. So that's our fifth electrode. That's also going to go in the fifth intercostal space to the left anterior margin. And then the sixth electrode here is going to go right at the axillary line. So right under the armpit, pretty much. So she's going to hook up the patient with the cords. Here's our leads, and they are very tangly. I'll let you untangle those. We try, and of course these are different everywhere, and everyone has their own technique when doing an EKG, especially if this is something you do in the hospital and you're an EKG tech and you're doing these all day long. You're going to have your own technique and your own way of doing them, and we do like to mention that this is a learning process. They are in school, so they're not going to do everything, 100% correct whenever they're practicing. But they do get to do an externship where they'll go and actually practice these things out in the real field on real people, just like we do in here, and they'll be able to actually see the different ways that the people in that office do the procedures, and they'll get the hands-on for that training too. Yeah, they're pretty tangled. But we normally pull out the first 4 on the outsides. Those are your limb leads, and that just kind of gets the lead wires untangled a little bit. This is sometimes a longer process, especially when you're new at it, just learning how to get all the leads placed and putting those electrodes in the correct places. And where's your little thingies here? So since our patient has no arms or legs, we're going to put one electrode up here for the left arm, one up here for the right arm, and then on the hips. And you can actually put your electrodes here in real life on a real patient. We always want to make sure we have the right electrode on the right leg, because this is our ground wire, and if this one's not on, the whole EKG will not work. Or you might get something, but it's not going to give you a current. Great job. Looks good. All of our electrodes are sticking. So we would check the EKG machine, make sure there's no artifact. I typically personally let it run for a few seconds and make sure there's no artifact and we have a good baseline normal sinus rhythm going across, or if they have a dysrhythmia, I'm going to check that out. And then we're going to press start and our EKG will print. We're going to give that to our physician or the provider and let them look at that. And we'll decide whether we need to run another one or we're good to go and we can take it off. So we're going to go ahead and take the EKG off of her. So go ahead and unclip. And I'll help you, that way we can get it off faster. We always unclip these so we don't fray the wires. Hey. Thank you, Caitlin. We miss you. So typically your patients are going to want to peel these off themselves because they kind of hurt, but we if we peel them off, we kind of do the little turn mechanism. That way it doesn't peel the skin or pull the skin. If you have someone that's really hairy, you might even have to shave your patient, so that way you can get these to stick on them really good, because if they're really hairy, they're not going to stick.